Good afternoon, everyone. Welcome to Critical Health Issue Corner. I'm your host, Dante Parker, and we have a great show for you guys today. We're going to talk about the ACA, the Iron Triangle, and many more in the issues we have today. Now, for my special guest, he is a fourth-year OT major, and he has a lot of knowledge on this topic, the Iron Triangle. Welcome to my guest, Scott Owens.
Woo! Cut.
How you doing today, Scott?
I'm doing all right.
So, man, I want you to explain to everyone exactly what is the Iron Triangle.
Well, basically, the Iron Triangle is how the health system tries to manage their system. It encompasses their quality of care, their cost of care, and the way that their patients can have access to their care. And right now, currently, the Veterans Administration is having a challenge with this because there's a lot of veterans that are miles away from the nearest clinic. And this year, they just started a program where veterans can actually, if they live within about a certain radius, like 40 miles from a clinic, they can get into what they call community care, and they're called Veterans Choice. And what that enables them to do is see their local provider in their hometowns, and all the services that they can get in the VA will be provided by their local community.
Okay. Well, I have another question. I know that the Iron Triangle consists of the cost, access, and quality. So tell me this. How would it affect the Iron Triangle if, for instance, the quality goes missing or if the access goes missing? So if one goes missing, how will it mess up the triangle?
Well, it messes the triangle in a way that the veterans would be the one to suffer from it, and actually the providers would also. The veterans would suffer because if the quality is not there, they're not going to get the benefits that they need, and they're going to have to live in pain. That includes physical as well as mental pain. The providers would also suffer because, as far as the cost goes, it's like any other government organization. There's always tangles in getting paid by the government, and so right now they're currently working on those issues. As it's designed right now, they are making it for so you don't have to get a referral from your primary care physician at the VA. You can just go primarily to your critical or your primary care person in the civilian side, and they're not actually doing contracts with these healthcare providers. They're actually signing agreements with them that they will provide the care and the government will provide the payments.
Okay. And my last question is, to you personally, how do you feel about the Iron Triangle?
I think it's a good concept. It's just a matter of keeping it all in balance, which is very hard to do because you can't affect one without affecting all of them. And it's very hard to get it to equal out altogether. So one is always going to be pulling on the other because you can't improve quality without raising the prices. And if you raise the prices, you're going to affect the access because people are not going to be able to afford to go get their hair done.
Sounds great, man. Thanks a lot for coming to the show.
Thank you.
Woo! Welcome back, everyone. Woo! This next topic you guys are gonna love, ethics. It's often overlooked and it plays a vital role in the healthcare industry. So for you guys, I got another special guest, Marcus, to explain to you guys. Welcome, Marcus.
Mark!
How you doing today, Mark?
Pretty good.
So explain, what exactly do you do?
I'm a doctor. I work at CMH.
Okay. So explain to the people exactly what ethics is in the healthcare industry.
Ethics in the healthcare industry is pretty much, in the medical field, it's just pretty much ensuring what's best for the patient.
It's best for the patient. Okay. So explain, is there any principle that goes along with it?
Yes. There are 4 principles. The first principle is autonomy. Pretty much autonomy provides is ensuring is allowing the patient to govern themselves. So let's say if a patient comes in and for whatever reason, let's say they're Jehovah's Witness, they don't want a blood transfusion. By law, we have to respect their decision to deny their request. So we have to respect their decision. Another one is ensuring justice. You want to always make sure all the laws are fair for each patient. You don't want to discriminate you don't want to have no discrimination against anyone by religion, race, or anything such as that matter. Another one is beneficence. You want to always do what's best for the patient. So you always provide the best service, the best medicine, and etc. And the last one is non-benevolence, and that pretty much ensures that you do no harm to the patient. Once again, you want to ensure that you provide the best service, the best healthcare for that patient. So altogether, pretty much all the four principles pretty much just provides, it ensures the best health and the best safety for that patient. Pretty much.
All right. And how do you feel about it? Do you agree with these principles?
I agree with it, but I don't feel like it's important until someone dies, and by that time it's too late.
Okay. Well, nice speaking to you. Thanks for coming out.
Thanks.
All right. You have a great day. Welcome back, you guys. In the hospital setting, you're going to go into a lot of patients who come from different religion, race, and different ethnicity. And it's very vital to be able to communicate with them effectively. This next guest is going to give us an insight of what exactly it is. Welcome, Zakia. So can you tell us exactly what is cultural competence?
Cultural competency is basically what a provider does. They have to understand a patient's beliefs or culture.
Beliefs and culture? Okay, so could you give me an example of cultural competency?
Yeah, actually in a Hispanic culture, they actually cater to their husbands. So for an example, a wife, husband hands get severely burned, and he has to learn how to eat again. And she basically, I don't want to say baby him, but she feeds him for herself. Instead of him actually trying himself, but a nurse will come in and take the utensils from the wife, which the wife would think that would be very rude of her, because in their culture, they see that as more of that's what they're supposed to do. They wait hand and foot for their husband.
Okay. Now, do you feel that for a hospital to be cultural competency, is that important due to the fact that in the hospital setting, there's a lot of people with different races, ethnicity, and religion? Do you feel that's important to have it in the hospital setting?
It's very important because that's poor communication between the healthcare provider and the patient. If you have poor communication, you have poor service. And that's why it's important.
All right. You heard it here first. Zakia. Man, this next guest, probably one of the smartest guys I've ever met in my life. He's gonna come and talk about what the ACA is. He knows it like the back of his hand. He knows it so well, you would think he wrote it. Welcome, Marlon.
Oh, yeah.
How you doing, man?
Good to see you. Good to see you.
Good.
Right.
Oh, man, you look nice, man.
I appreciate it, man. Can't measure up to you, man. You got a nice suit, man. Great suit.
Thank you.
Like it.
So, just tell the people exactly what the ACA is.
Okay. Well, ACA was passed in March 23rd of 2010 by Obama. What it's going to do is, what it did do was lower Medicare and Medicaid costs, expanded Medicaid, and then it gave cuts in the premiums, cut on premiums for many citizens in America. Okay, so that helped out the people who could not get existing claims or insurance plans before. So if you had HIV or AIDS, any type of overweight issues, obesity, any type of issues, pre-existing conditions, mental health issues, you were not covered. So with the ACA being enacted, many citizens were able to get health care benefits.
Okay. So tell me this. It sounds too good to be true. Is there any issues that's happening with the ACA?
There's hiccups from time to time, but like what Trump is doing now to dissolve the CHIP program, saying that a lot more money is going towards the programs for the needy or people who need it. That is what I believe America is here for. Our debt should not be measured by defense or other issues. We are here to help other citizens. Isn't that the biggest goal here? Okay, so when we do go into debt or have little issues with money, it's more so kind of if from the other side they're looking at our money being placed in the wrong area, which is not that the ACA is recommending and reforming how we look at healthcare benefits.
Okay. Now with this, are you for ACA?
Definitely. With the ACA, we have parents who can add their children on their healthcare plan up until 26. That helps a lot of people who may be going through college or out of college and have not yet found a job. That is a big issue in our society today. After college, we have to find something to do. You have Medicaid expansion. There's a gray area for a lot of people who cannot get the necessary health care access. They don't have the funds for their health care. So with that expansion, a lot more people can get covered, be seen by a doctor, and get healthy. We want a healthy America.
All right, my last question. There's a lot of hard-headed Americans in America who, with this great thing that's happening with the ACA, still doesn't want to, purchase or get it. Are there any repercussions in not getting it, such as like a fine or anything of that nature for not getting ACA?
There was a fine at one time to if you did not sign up at the right time or if you don't have health insurance. I'm not sure if that's still going on now, but for sure, if you did not sign up for Obamacare, you're losing out on tax exemptions, you're losing out on certain money that can benefit you, especially if you're middle class. Some of the subsidiaries are working in your favor.
Oh man, it sounds good. You heard it here first, man.
Woo! You didn't hear that,
Man, what a great show we had today. We had Scott come in, we had Marcus come in, we had Zykia come in, and tell us a bit of what's happening in the health industry right now. Thanks for tuning in. We'll see you later.
We were brought up to believe that we live in the greatest country in the world, but until a few years ago, millions and millions of us had no access to health insurance at all. Before 2014, if you were born with congenital heart disease like my son was, there was a good chance you'd never be able to get health insurance because you had a pre-existing condition. No parent should ever have to decide if they can afford to save their child's life. It just shouldn't happen.